Have you ever woken up with a dull ache in your jaw or found yourself clenching your teeth tightly during a stressful moment without even realizing it? Perhaps you've dismissed it as just a bad night's sleep or a habit, but for many, this persistent tension is a clear physical signal from an overwhelmed nervous system. It's a widespread, often underestimated problem that can truly impact our daily comfort and well-being. Today, we're going to delve into the fascinating and often frustrating world of anxiety jaw tension. We'll explore why our bodies react this way to stress, the surprising range of symptoms it can cause, and most importantly, what practical, evidence-informed steps we can take to find relief. It's more common than you might think, affecting a significant portion of the population, with estimates for things like teeth grinding or bruxism often cited between 10% and 30% of adults. This isn't just about discomfort, it's about understanding a deep connection between our mental and physical health. So, why does anxiety often manifest as tension in our jaws? The answer lies deep within our primal survival instincts. When we encounter stress or perceive danger, our body activates what's known as the fight or flight response. This ancient mechanism floods our system with stress hormones like cortisol and adrenaline, preparing us to either confront a threat or flee from it. Think of it like bracing yourself for impact. Our muscles instinctively tense up, ready for action. And guess what? The muscles in our jaw, particularly the powerful masseter muscles that help us chew, are no exception. They become part of this readiness, contracting, often unconsciously, as a primitive protective measure. Now, while this response is vital in an emergency, the challenge arises when anxiety becomes chronic. If we're constantly in a state of worry or hypervigilance, our bodies can remain in this on-guard mode for extended periods. This prolonged, sustained muscle contraction in the jaw can become habitual, leading to persistent soreness, stiffness, and even pain. Researchers are also exploring how imbalances in brain chemicals like serotonin and dopamine, which regulate mood and movement, might play a role in why some individuals are more prone to jaw clenching. The effects of this constant tension extend far beyond a simple ache. One of the most common manifestations is bruxism, the unconscious grinding or clenching of teeth. This can happen during the day, perhaps when you're deeply focused or stressed, or more frequently while you're asleep. Over time, bruxism can lead to significant tooth damage, wearing down enamel, causing sensitivity, and even fracturing teeth. Beyond the teeth, persistent jaw tension places immense strain on the tympanomandibular joint or TMJ. This is the intricate hinge that connects your jawbone to your skull, allowing you to open and close your mouth, chew, and speak. When overworked by constant clenching, this joint can become inflamed, misaligned, or dysfunctional, leading to what's known as a TMJ disorder, or TMD. This often creates a painful cycle, where the physical discomfort of TMD can actually exacerbate feelings of anxiety, making the original problem worse. The associated symptoms are diverse and often surprising. You might experience chronic pain or soreness in your jaw, which is frequently worse in the morning. There can be a noticeable tightness or stiffness, limited jaw movement, or even clicking, popping, or grinding sounds when you open or close your mouth. Headaches, particularly tension headaches or even migraines, are very common. This tension can also radiate, causing pain in your neck and shoulders, leading to tooth sensitivity, difficulty chewing certain foods, earaches, and a general feeling of facial muscle tiredness. In some cases, chronic jaw tension can even be linked to sleep disorders like obstructive sleep apnea. So if this sounds all too familiar, what can you do? The good news is that there are many effective strategies, starting with self-care.
One of the most immediate steps is jaw relaxation. Gently massaging your jaw muscles can provide relief. Try using a warm compress on the affected area for about 10 to 15 minutes to help relax the muscles. Specific, gentle stretches can also be very beneficial. For example, slowly opening and closing your mouth, moving your jaw gently from side to side, or simply practicing the jaw drop, allowing your jaw to hang loose with your lips together but teeth apart. A simple yet powerful tip to focus on proper tongue positioning. Rest your tongue lightly behind your top front teeth and let your jaw relax with your teeth not touching. Mindfulness techniques are crucial for breaking the anxiety tension cycle. Deep breathing exercises can calm your nervous system, signaling to your body that it's safe to relax. Conscious jaw relaxation throughout the day, where you periodically check in with your jaw and deliberately release any tension you find, can be incredibly effective. Beyond this, consider temperature therapy, warm compresses for relaxation, and cold packs to reduce inflammation. Temporarily adjusting your diet to soft foods and avoiding chewy or hard items can give your jaw a much-needed break. And of course, broader lifestyle modifications are key. Practicing good posture, engaging in regular exercise, ensuring adequate sleep, and consistently implementing stress reduction techniques like yoga, meditation, or journaling. These all contribute to a calmer nervous system, which in turn reduces physical tension. While self-care is a powerful starting point, sometimes professional intervention is necessary, especially if pain persists or significantly impacts your daily life. Your dentist, particularly one specializing in TMJ/TMD, can be a vital resource. They might recommend dental appliances like custom-fit night guards or oral splints to protect your teeth from grinding and help position your jaw correctly, especially during sleep. Physical therapy focused on the jaw can greatly improve flexibility, alignment, and help retrain your jaw muscles. When it comes to medication, over-the-counter pain relievers or NSAIDs can help with acute pain and inflammation. In some cases, your doctor might prescribe muscle relaxants. For severe, persistent cases, injections like Botox can be used to temporarily relax overactive jaw muscles, or corticosteroids might be used for joint inflammation. Crucially, remember that anxiety is often the underlying driver. This is where mental health therapy shines. Approaches like cognitive behavioral therapy, CBT, or acceptance and commitment therapy, ACT, can help you identify and manage anxiety triggers, develop healthier coping mechanisms, and ultimately reduce the stress that contributes to jaw tension. Addressing the root cause is often the most sustainable path to long-term relief. You might also explore support groups, which offer a community of understanding and shared strategies. Other interventions like biofeedback, which teaches you to control involuntary bodily processes, or transcutaneous electrical nerve stimulation, TENS therapy, can also be beneficial in managing pain and promoting muscle relaxation. Dental procedures like bite adjustments or restorative work might be considered in specific circumstances, though some, like bite adjustments, can be controversial due to their irreversible nature.
It's important to acknowledge that diagnosing the exact cause of jaw tension can sometimes be challenging. This is because it's often multifactorial, meaning many things contribute to it. It's not always just anxiety. It could be dental misalignment, arthritis, an injury, poor posture, other sleep disorders, or even certain medications. This brings us to a significant point. A small percentage of people find that certain antidepressants, specifically SSRIs and SNRIs, can actually induce or worsen jaw clenching. This can be a tricky dilemma for both patients and healthcare providers. Knowing when to seek professional help is a common question, and generally, if home remedies aren't enough, if you have persistent pain, loud jaw sounds, or signs of dental damage, it's definitely time to consult a professional. Bringing it to a close with encouragement. Understanding the connection between our minds and bodies is the first step towards relief. Anxiety jaw tension is a clear message from your body, asking for attention and care. It's not something you have to simply endure. Looking towards the future. The future of managing this condition is looking promising, with ongoing research delving deeper into the neurobiological underpinnings of bruxism and the role of neurotransmitter imbalances. There's a growing emphasis on integrated care approaches, bringing together dentists, physicians, physical therapists, and mental health professionals to offer a holistic treatment plan. As public awareness continues to grow, we can expect more innovative therapies and accessible solutions to emerge, further improving treatment outcomes for this prevalent condition. Final empowering thought. Remember, finding relief is a journey, not a destination. By patiently exploring these strategies and collaborating with healthcare providers, you can significantly reduce your discomfort and regain a sense of calm and ease in your jaw and in your life. Take that first step towards understanding and healing.